retinol, vitamin A, retinoids, lots of questions, and it's taken me ages to do this, and I apologise. It's just been crazy, the whole back to school, real school and the clinic. It's just been quite intense the last few weeks, but here we go. So I'm just going to run through. I don't understand. Oh no, sorry. Does it work? That's the first question. I mean, I skipped over that because yes, vitamin A is like right up there. It's second only in my book to sunscreen in terms of its efficacy and importance in a regime. In terms of slowing things down, but also repairing damage. I mean, this is an ingredient that is proven to actually get deep enough in your skin to directly work on the cells in your dermis that pump out new collagen. So a lot of the other ingredients and all the promises you hear, it is important. What's going on in the more superficial layers of the skin is important. And it definitely, a healthy skin barrier, healthy epidermis will impact collagen levels and the density of your dermis, yes. But this ingredient actually gets right in there and actually stimulates new collagen production. It blocks the breakdown of collagen as well. It improves blood supply, actually stimulates new blood vessel formation. So that's why after months of use, I can certainly tell in my clients that this sort of nice, lovely pinkish colour to the skin comes back. No more sallow. What else? It acts as an exfoliant as well. So it's, but not like acids or scrubs where you're removing the dead cells from the outer layers. Actually, by stimulating new cell production in the barrier layer. So in the base of that layer, so that pushes out the dead cells. So I mean, there's more, but anyway, enough, okay? It's a very potent, active ingredient. I'm a fan. I don't understand the different types of retinoids. It's tricky. It's a minefield, and yeah, it's hard work actually to work out what's in the percentages and strengths and all the products out there. I mean, I'm not going to give a sort of textbook response to this. I mean, basically, prescription strength, retinoic acid, yes, that's the sort of gold standard, and that's, going to get you the results quickest. But, a lot of people just won't tolerate that, or certainly straight up. And there's always a fine line between, yes, how potent and active the ingredient is versus, making sure that you're not stressing your skin too much introducing the ingredient. So I think absolutely start on an over-the-counter ingredient like retinol, retinaldehyde. These are all just derivatives that actually convert within your skin to the ingredient that will then directly work on the receptors that the prescription product works on. So, and you can get there. It takes longer, but good retinol, you can get there. You can get the same results as a prescription product if you use it correctly and for long enough. What is right for me at different ages? I mean, it's so individual. Prescription strength is used on teenagers for acne. So it's not, and yeah, in your 30s, yes, for many skin types, it's okay to go straight to prescription strength. But it depends what you're trying to address. I mean, obviously I wouldn't use it, you mustn't use it during pregnancy, breastfeeding, so there are gaps there. And it does depend on like my 3 rules, keep it simple, do no harm, and be responsive. So, be responsive. If you're not getting on with a certain vitamin A, switch it up, try something else, give your skin a break first, and then go and try a different ingredient. But I have to say also, most people can tolerate it. It is about how it's introduced. It's about sometimes preparing your skin before you introduce it. So really calming and strengthening the skin barrier, which can take 12 weeks before you introduce it. So there are ways. Most people can tolerate a prescription retinoid. I actually, as I'm talking, I think also I should mention the sort of botanicals that are coming out. It's pretty exciting at the moment. These new products and ingredients that it's touted as alternatives, but that do actually work on the same receptors and without the irritation. So Biden's Pelosa is one of them, and bakuchiol is another botanical that is really, is getting some good results too. So everyone can find a retinoid that suits their skin. I mean, here, yes, is it good for acne? We've talked about for sure. And pigmentation, it does help pigmentation. It takes time, it really does. And so in the clinic, we often combine vitamin A with other ingredients. So whether it's, acids, hydroquinone, etc. But it will work on its own for a lot of people. It does take time. Acne scarring, sun damage, yeah, absolutely, because that's all about trying to boost collagen reserves and levels of collagen in your skin. I use one every day, but my skin never goes red. Does it mean it's not working? No, it's not. That's not common, and lucky you, it means you've got very resilient skin. Most people will have some irritation those first few weeks, even if it's just that you're aware that your skin is a little bit more sensitive, it flushes a little bit more easily, it feels a little dry, a bit tighter, right up to, actually some people do see flaking, especially around the mouth. So avoid those areas when you first start, and just work up to using it on the full face. But no, it doesn't mean you don't have to peel and flake and go through that for it to be working. Can you rub it off? You need to wait. I advise that you wait, so you should apply it at night. Certainly the prescription product you should apply at night. There's some really nice formulations now that you can use in the morning. Problem with a vitamin A is that it's broken down by UV rays. That's the reason not to use it in the morning. It just inactivates it. The sunshine inactivates your vitamin A. But there are some formulations now that have been really cleverly incorporated that you can. So just do what it says on the box. But a prescription retinoid should always be used at night. So cleanse, put it straight onto your skin, wait 20 minutes before moisturizing. And that's so that you don't rub it off and you don't dilute it unless you want to dilute it. So if you are struggling with some irritation, especially those first few weeks, do use it, dilute it a little, put a little bit like of a buffer your skin first before applying it. Anyway, I'm getting carried away. That's how to cope with the first few weeks. I'm sure someone's asked about that too. My doctor told me Retinol is not for everyone as it can cause little blood vessels. Yeah, we've sort of covered that. It is, I think everyone can find a retinol that works for them, a retinoid. But yeah, if it's causing a lot of inflammation and it's exacerbating sort of redness in your face, etc., be responsive. Don't push your skin too hard. How to use with rosacea? It can be used in rosacea. A lot of our clients with rosacea we do prescribe retinoids for. So not in the angry phases for sure. That's the last thing angry skin on red alert needs. But when things are calm, we want that. We want a denser dermis. That's going to help with ongoing management of rosacea. When do you stop using them, if ever, assuming no adverse reaction? Never. Apart from if you're pregnant or breastfeeding, if you're tolerating them well. I suppose I have a lot of clients who choose to come off them during the summer months. It really depends on, how careful you are in the sun. You've got to be honest with yourself. You need to be super, super careful. Certainly within the first few weeks of starting a retinoid, do not start. I rarely start a client on retinoids immediately before the summer or before a holiday, before going skiing or anything like that, when you're going to get a little bit more UV exposure. Those first few weeks, your skin definitely will be more sensitive. And you'll be taking one step forward but two back. So no, that's not the time to start. But once your skin is calm, you can use a retinoid year round. I do. But hat, glasses, fact 50, all that shebang. Okay, if you're not going to be doing all that, then maybe pull back. So stop using for those few months of summer, but know then that you're going to have to go through the whole retinization process again in the autumn. You're cool. Any tips for using if you live in a hot climate, apart from SPF? Again, as I said, I have no issue with it being used year round and in hotter climates. Again, be super, super careful those first few weeks until your skin is calm. Is Tret better than the over-counter retinoids? We've talked about that. It's quicker, it's stronger, but not necessarily better. Can I mix it with other serum products? Okay, that's a big question. I mean, generally keep it simple, I would say, but once your skin is used to it and you know the products you're using, and you know what, if there is a problem, you know which one it is and how to address it. I mean, yes, I do use my retinoid some evenings with other serums as well. So that's it's not a no-go. But I wouldn't mix it. You apply them separately and layer. Dermatica or ZO, Dermatica and Skin and Me, like great. This is, of course, you can buy prescription retinoids through the clinic here, but also these are great sort of services where you can have online consultations with dermatologists who then prescribe, you know, a huge variety of different concentrations and combinations of retinoids with other ingredients. I'm a fan, and it works the way they step up concentrations and work with your skin and your responses through the months. They're both good services. ZO is a brand. It's a branded prescription retinoid that comes with a ZO system. Actually, also they do have retinol products as well. Dermatica, Skin and Me, prescription retinoic acid providers. It's summer, do I have to peel? No. And can I combine vitamin C and acids? Yes. One last thing on that, actually, I was a little bit vague with combining and using other serums, and actually I think the best for most skin types, once you've done that retinization period and you've introduced your vitamin A, and during that period I would say pull back on all the other actives, focus on the vitamin A. But once your skin is calm and you're good to go and you're using it every night, the idea is that you use it for 6 months every night and then pull back to just boost a dose, so using it 2 or 3 times a week. And potentially then the other nights, I have a sort of system of 3 nights. One night I'll use my vitamin A, second night an acid, third night my night off. You know, that's when I'll use my other lovely sort of oils and massage my skin and take time just for a little bit of downtime. Okay, that's it. Hope that was